As the healthcare industry continues to shift toward value-based care, opportunities to improve patient health and increase practice revenue multiply. Codes associated with chronic care management add monthly recurring revenue to practices. Services such as transitional care management provide true continuity of care, and new value-based programs like MACRA and care delivery models like CPC Plus provide physicians with incentives for meeting quality measures. The common thread linking all these opportunities together is care coordination. Care coordination helps patients navigate our fragmented healthcare system. It recognizes the vital role patients, family members, and caregivers play in helping patients get healthier faster and stay healthier longer. It connects all care team members, including all the healthcare providers involved in the patient's care. This is so everyone can work as a team to achieve optimum results. So why is this important? When you think about it, most of a patient's healthcare happens outside of the doctor's office, where patients live, work, and play. Ensuring a patient adhered to their medications would be a lot easier if they were in the doctor's office all day, but they're not. Patients with chronic conditions like diabetes, high blood pressure, and high cholesterol need to monitor their conditions and keep track of their results. Doctor's instructions given in the exam room might be forgotten by the time the patient gets to the parking lot, and sending a patient for lab work or referring them to a specialist isn't valuable if the patient doesn't follow through on the tests or appointments. Patients with chronic conditions need additional support if we're going to accomplish the core objectives of delivery system reform: better care, smarter spending, and healthier people. That's why programs like Medicare's chronic care management and initiatives like MACRA were created. With care coordination at the heart of so many programs like CCM, MACRA, transitional care management, annual wellness visits, and CPC Plus, the healthcare industry is poised for dramatic positive changes. Through care coordination, what happens between doctor's visits isn't the mystery it used to be. Care coordinators identify and address potential gaps in care, ensure patients follow through on their doctor's instructions, set appointments, and provide reminders about them. They also identify social or community resources that can connect patients with disease support, health education, transportation to medical offices, healthy meals, and more. To receive the incentives many of these value-based programs provide, doctors are required to provide their patients with between-visit care, but that's a high demand to place on a healthcare practice's time and resources, especially when doctors, nurses, technology, and budgets are stretched thin. That's where we come in. CareSync acts as a true extension of your practice, available to your patients 24 hours a day, 7 days a week. We follow your preferences and protocols, build relationships with your patients and their caregivers, and effectively deliver care coordination services on your behalf. As the nation's leading provider of chronic care management services, we can support your efforts with CPT code 99490, complex CCM codes, and add-on code G0506. We also help you report and meet MACRA quality and performance measures no matter which path you're on. Additional care coordination services include annual wellness visits, transitional care management, and support for CPC Plus. To learn about these and other solutions from CareSync, please call 1-800-501-2984 or email sales@caresync.com.